Hello everyone, my name is Kayla Mahoney. I'm an exercise physiologist and current supervisor at the Dean Ornish Intensive Cardiac Rehab Program. Today I'll be talking to you all about osteoporosis. Objectives for today's class are to define what osteoporosis is, talk about its many risk factors, some of which you do have control over, talk about screening techniques that your doctors may administer, as well as treatment options. But more importantly, we'll be discussing preventative techniques for addressing this condition. Many of you may already be aware that osteoporosis is the loss of bone mass. We know that bone mass peaks at age 30 and continues to rapidly decline with age, particularly after menopause because of the drop in estrogen. Ultimately, what's happening inside your bone tissue with osteoporosis is two different types of cells are competing with one another. There's both the osteoclast as well as the osteoblast. The osteoclast functions to disrupt and break down old bone, whereas the osteoblast helps to build and place new bone tissue down. So we want these ideally to be equal, but when you have osteoporosis, you're breaking down bone much more rapidly than you're building new bone. This leads to bones becoming extremely brittle and more prone to fracture. We know that the hip is the most common fracture site, but there are other areas that can be impacted as well. So when reviewing these images, from left to right, top to bottom, the first is the common hip fracture site. Then moving on, we see a fracture of the vertebrae or spine, as well as a pelvic fracture, wrist fracture, and upper arm fracture. We want to prevent all of these from happening. None of this feels good. So we want to do everything that we can to prevent any one of these fracture sites from occurring. So risk factors. Just like with heart disease, there are non-modifiable and modifiable risk factors for osteoporosis. Non-modifiable risk factors, of course, we have no control over. If you're a white Asian female, this will predispose you to the development of this condition over time. If you're over 50, experienced early menopause prior to age 45, have a first-degree relative, mom or dad, with this condition, if you developed your menstrual period late or had the absence of a menstrual period for an extended period of time, that can increase your predisposition. If you have a small, thin frame for most of your adult life, being under 125 pounds, any history of previous fracture, this bullet point here is really with regards to repetitive stress fractures that may have been sustained with sports like running, even dance or gymnastics. So those types of fractures in younger years can predispose you to development of osteoporosis. Also inflammatory diseases like celiacs, irritable bowel disease, and lupus, as well as corticosteroid medications. I'm not talking about topical steroids for skin conditions. We're talking about oral steroids like prednisone that you may be taking frequently for COPD exacerbations or asthma exacerbations. These can brittle your bones over time and make you more susceptible to osteoporosis. On the other half of the slide here, though, we do have our modifiable risk factors, things that you do have control over. Heavy smoking and heavy drinking. Osteopenia would actually be the equivalent of a pre-diabetes. So you don't have the condition quite yet, but someone has identified that you are at risk for things progressing and becoming osteoporosis soon. History of eating disorders, calcium and vitamin D deficiency. If you have an eating disorder or are calcium and vitamin D deficient, you're not getting proper nutrients or sun exposure. These two vitamins and minerals are actually contributing to new bone development, so it's really important that we get enough of those in our lifestyle. Lastly, sedentary lifestyle. If we move more, surprise, surprise, our bone health is going to be better. So diagnosis and screening for osteoporosis. The gold standard technique for measuring whether or not an individual has osteoporosis is through a DEXA scan, or dual X-ray absorptiometry. Again, it's the gold standard technique where you lie down on a table and a shield goes over your body and performs this scan. It's not invasive. You're not exposed to much radiation with this technique. Anyone over the age of 65 and female is probably going to have had a DEXA scan. But if you're younger with lots of risk factors that we just discussed, you may be subject to this scan as well. And what we're ultimately looking at is the results of this exam in the form of T-scores. So we look at the normal bell curve, if you recall from years and years past of maybe statistics classes. What we're doing is comparing a patient's bone density to that of a healthy 30-year-old of the same gender. So if you're looking at a normal bell curve, that normal, healthy 30-year-old female is going to be right in the center of the curve. With folks who have osteopenia or pre-osteoporosis, their T-score is going to be between -1 and -2.5. With osteoporosis, your score is less than -2.5, and in severe cases, your score is less than -2.5. So the further and further negative you are away from zero, the more severe your bone mineral density loss. So what's cool about these body scans is we can actually look at your entire body and then separate it out into segments. So this is just an example here of how they would use that T-score to quantify how much bone mineral density has been lost and diagnose whether this individual has either osteopenia or osteoporosis. In the colorful chart, we see that the average T-score falls about -1, which would put this person in the osteopenia category. So this slide is just an example of how we can look at body segments. This is actually an image of the hip where we can track change in bone mineral density over time in a specific joint. So how does your doctor process your DEXA results? If you're normal to -1, we say keep on living your life. Maybe we'll repeat this scan 10 to 15 years from now. If you've been diagnosed as having pre-osteoporosis or osteopenia, turns out you're getting older. Lots of women are going to fall into this category. It's not really a place for concern yet, but they may have you return to repeat your scan in 2 to 5 years, depending on your severity. But if you have been diagnosed as having osteoporosis, of course, your bones are now brittle and you're more susceptible to a fracture, so your provider's probably going to discuss some treatment options for this. I do just want to note that this condition is extremely prevalent. 1 in 3 women and 1 in 5 men over the age of 50 worldwide have osteoporosis. In total worldwide, it is estimated to affect 200 million women. More than 1/3 of adult women will suffer from 1 or more osteoporotic fractures as a result of their osteoporosis. And to no surprise, this places a significant economic burden on the US, which cost a total of $17.9 billion. But don't worry, there's something we can do about it. But what is it? Just think about it quickly. What do you think you can do to address your modifiable risk factors to prevent the occurrence of osteoporosis? First up on the list is consuming a diet rich in calcium and vitamin D3. Foods that are rich in vitamin C are many fruits as well as green leafy vegetables. Supplementation will be required for some, but it's really important that you get this recommendation by your doctor before taking any over-the-counter supplement, as they can interact with your current medication regimen. If you're following DASH and Mediterranean-style diets that are low in sodium and high in whole grains, fruits, vegetables, and low in fats, we know that these 2 types of diets have been shown to have bone-sparing effects. Important to reduce or limit alcohol, soda, and caffeine consumption. And extremely important that you're not using tobacco products or smoking. If you are still smoking and have the desire to move towards quitting, fortunately we have those resources here that will help you to reach your quit date while you're here in the program. If you experience menopause before the age of 45, estrogen replacement therapy may be a good option for you. It's important to speak to your provider about this because it has its own set of risks. But more importantly, while you're here in cardiac rehab, we can address prevention with your exercise, making sure that you're exercising regularly, both at home and at cardiac rehab. The most important type of exercise, though, for improving your bone mineral density is weight-bearing activity. Weight-bearing activity actually puts impact on your bones and will allow them to be remodeled over time. So things like walking, dancing, tai chi, using the elliptical, climbing the stairs, these are all weight-bearing exercises. Resistance training can also be extremely beneficial. Large muscle mass exercises like climbing stairs, sitting and then rising up and down from a chair, or even doing some of the weight machines here with us that involve more muscle group are going to have the biggest bang for your buck when trying to improve your bone mineral density. So it's of course relevant that we begin to have a conversation also about fall prevention. The first thing that we can do to help prevent falls is to remain active. If we're active, we're going to have greater strength in the lower body, as well as your core or trunk, and improved balance. Making sure that you're going to the eye doctor every year to have your eyes checked. If you can see where you're going to be in much better shape to scan your environment and prevent tripping over things that may or may not be in your way. Addressing any symptoms that you're having currently from your medications is extremely important. If you're regularly feeling lightheadedness and dizziness, this alone can predispose you to falls, so make sure that you're addressing these symptoms with your provider immediately. Wearing correct footwear is also important. Wearing stiletto heels, flip-flops, and wooden clogs probably isn't the safest option. Wearing a rubber-soled supportive shoe is certainly going to help you to get around a little bit more easily and prevent falls. Considering the types of rugs that you have decorating your home, if they're slipping around, if they're really high and they present a hazard for tripping or slipping, make sure that those are either removed or addressed appropriately. If you do require assist devices like a cane or a walker, make sure they're in good working condition, but also be sure that you have enough room to move throughout your home with these devices safely. Also consider use of handrails, grab bars, or benches in your shower, as well as entry and stairs within your home if needed. You can even consider using a non-slip mat in your shower and on the bathroom floor to prevent slip and falls from happening. And lastly, installation of night lights might be helpful. Many of our patients report the increased use of bathroom breaks during sleep, so it's a good idea to be able to navigate your hall safely to go use the facilities at night. So in addition to quite a few videos that I've contributed to our program YouTube channel, which is called the Miriam Center for Cardiac Fitness, there's lots of local programs within the community where you'd be able to access bone strengthening group exercise classes. I have Bone Builders of Rhode Island on the slide here with their website and phone number. Many of these programs are offered at local community churches for free. Some of them are by donation. Most of them run 1 to 2 times per week. So if you visit their website, you can see exactly where their class offerings are currently located. Inquiring with local senior centers as well as YMCAs for their offerings for group fitness classes for active seniors will also be excellent in improving your bone health because many of these types of classes are going to offer weight-bearing exercises in a comfortable setting. And I thank you so much for listening. If you have any questions, go ahead and approach the staff here at the facility and they'll be happy to answer them for you. Have a great day.